My name is Max Pianic. I'd like to welcome you to the Dr. Collins Show, where Dr. Collins will take time each month to help talk and educate you about a variety of issues relating to your health. First, I'd like to start by introducing you to your host, Dr. Collins. Dr. Collins is currently the medical director for ConvenientMD, and previously was the medical director for Mass General's Urgent Care Center in Chelsea, and also the medical director of the Center for Mass General Center for Community Health Improvement. Dr. Collins also teaches at Harvard Medical School and at Mass General. He's also the chairman of the Urgent Care Foundation and on the editorial board of the Journal of Urgent Care Medicine. With that, I'd like to turn it over to Dr. Collins.
Welcome.
Dr. Collins, we wanted to take the opportunity today to learn a little bit about urgent care. And with that, I was going to, if it's all right with you, take the next half hour to just talk a little bit about urgent care and ask you a variety of questions, given that you're an expert in the field.
Absolutely.
So Dr. Collins, if you wouldn't mind starting by just telling us a little bit about urgent care. What is urgent care?
So urgent care centers see patients on a walk-in basis for a whole variety of acute injuries and illnesses. No appointments are needed and people can walk in at any time. They're usually open for extended hours. Ours occasionally 8 to 8 or 9 to 9, and they're open 7 days a week.
Great, great. And what is urgent care medicine? How is that different from other aspects or scopes of care?
So urgent care medicine is a term that you're starting to hear more and more, and it's interesting because one of the things urgent care does is it actually involves a lot of different specialties. And so in the urgent care, you're going to need to know a fair amount of internal medicine, pediatrics, obstetrics, gynecology, orthopedics, and other subspecialties. And so the urgent care doctor, like the emergency medicine doctor and the primary care physician, really needs to be versed in a lot of different topics because anything can sort of walk into the center at any time.
Great, great. And is urgent care a new idea? It seems like, you know, everybody talks about, hey, there's an urgent care center popping up on every corner. It feels like that to a lot of people because but is it a new concept?
It's a very interesting question. So, you know, urgent care actually got its start in the 1970s, and there was a group called the National Association for Ambulatory Care that was founded in 1973, and it was one of the first associations that dealt with practices that saw patients on a walk-in basis. That evolved over the next couple of decades. In the late 90s, two organizations branched out from there, the American Academy of Urgent Care Medicine and the Urgent Care Association of America. And so now there's large groups nationally that sort of represent urgent care centers. It was always a niche between the primary care physician and the emergency department, and there was always that open space in terms of what I needed to do if I couldn't go to my primary care physician, but I didn't necessarily feel I had a severe enough illness or injury to warrant a visit to the emergency department. And so urgent care sort of fit into that space in healthcare.
Got it. So is it, so if it's been around since the 70s, how many urgent care centers are there today?
So another interesting question. A lot of that depends on how you define urgent care or an urgent care center. If you use national definitions in which the facility is open 7 days a week, it has lab on site, it has x-ray on site, and is staffed by physicians, the number's probably around 4,000 to 5,000. A lot of people call themselves urgent care centers but don't meet national standards or national guidelines. And then if you look at that, the numbers may approach 8,000 to 10,000.
Got it. So 8,000 to 10,000, so somewhere between 5,000 and 8,000 to 10,000, quite a lot.
Yeah.
How about, I guess for myself, I'm from Florida originally, and so when I go home and visit my family in Florida and I drive around, I see a lot of urgent care centers. And it seems like there's urgent care centers, maybe as many as there are coffee shops.
Right.
But driving around New England, that's much less so the case. Even though it's I guess it seems like they're being developed more frequently up here now. But Why is that? Why is that the case?
So, interesting point. I mean, urgent cares nationally got more of their start out west, sort of in the Midwest and California and those areas, and then sort of branched to Florida. And so the southern states, the southeastern states, the western states, and the southwestern states had a fair advance on what's been happening in New England. But I would say really within the last 2 to 3 years, there's been a big influx of interest in urgent care in the New England marketplace. And so a lot of groups have a strong interest in sort of coming into New England. And so more and more groups are interested in this area.
Mm-hmm. Interesting. Why do you think that it may not have that it's taken a little longer maybe to develop up in New England?
I think there's a combination of factors. I think here in New England we have great primary care physicians, and people have great relationships with their primary care practices, and this concept of a patient-centered medical home is very strong, as it should be. And so I think that's one reason, because people have gotten excellent primary care. The second reason is that if you look at our system, we have some very predominant hospitals. Some of those are academic medical centers. Some of those are freestanding nonprofit hospitals. And these hospitals have done such a fantastic job of sort of providing care that there wasn't really a need for a lot of services. What's happened now is as primary care has become more strained, has hospital-based emergency departments have become more strained and overcrowded, this niche for urgent care has sort of opened up.
Okay, great. So what does an urgent care center actually do? Who should walk into that? Who should walk into an urgent care center?
Well, very long question, but in a sense, anybody with an acute illness or injury can walk into an urgent care. A lot of times we see run-of-the-mill illnesses like colds and flus, sinusitis, bronchitis, pneumonias, those types of things. A lot of times people are coming in because they just can't get a timely appointment with a primary care physician, or they don't have a primary care physician. At other times they've had ED experiences in which they don't feel the illness or injury that they have sort of warrants that level of acuity. And so coming into the urgent care makes a lot of sense. The other part of that question are there are clearly conditions that you do want to go to an emergency department for. And so severe headache, signs of a stroke, chest pain, severe abdominal pain, severe trauma, loss of vision, these types of things you would really want to head right to your emergency room.
Got it. And so could you give us just maybe a few more examples of like the types of things that you see regularly, just kind of from maybe a low acuity visit to a higher acuity visit that would be appropriate for so when people think, hey, this happened to me, where should I go? What would be some of those? What would be a few of those things?
Sure. So I can take it from the head down. And so, a lot of times, if you look at the eyes, foreign bodies in the eyes, conjunctivitis, common eye infections, those types of things, we're more than happy to see in the urgent care. Infections in the ears, wax that's blocked your ears, foreign bodies in the ears, we're all happy to look at. Upper respiratory problems like pharyngitis or sore throats, sinusitis, bronchitis, pneumonias, those types of things we're happy to see. Nausea, vomiting, dehydration, we're also happy to see. The whole range of orthopedics and sports injuries that generally present to the primary care physician, we're also happy to see. Any rashes, dermatitis, those types of things. And of course we see all ages, so from newborns all the way to the older person we're happy to see.
Great. And so from an age perspective, it's all ages. A mom with a 6-year-old baby, do you see a lot of that?
So, just to give you an example, just this week we saw a 1-week-old baby who dad accidentally didn't have strapped into the bassinet, who took a little spill, so that was probably the youngest we've seen, all the way to a 96-year-old gentleman who had some abdominal issues. Wow! So
great! Wow!
Wide range.
Certainly a wide range in only a few months. And so, how about from a staffing perspective? Who works? If a patient walks into an emergency room, who's going to be treating them?
So, generally in an emergency room, you'll have a physician or physician's assistant, attending to the patient. In the urgent care setting, it depends on the urgent care. And again, it's usually a physician or a physician's assistant, occasionally nurse practitioners who are staffing. I would say the most common model would be a physician with some physician assistants would be the most common. There's usually a nurse, medical assistants, an x-ray technician, occasionally lab support people, front desk receptionists, and usually a compliance or billing person.
Got it. And at your facility at ConvenientMD, is there always a doctor on site? Might there only be a physician assistant on site? How do you staff that?
So
facility?
we always have a physician on site. So
right.
During all times of openings, there's a physician there and there's a nurse there.
Okay, great. And what type of training are the doctors typically have? Do the doctors typically have?
So in urgent care, again, from a physician standpoint, it can vary a little bit. I'd say that the major training for physicians in urgent care settings nationally would be family practitioners. Now we're seeing a lot more emergency medicine trained people moving into the urgent care field. We're seeing med-peds physicians moving into the field. And we're even seeing straight pediatric urgent cares and adult urgent cares also.
Great, great. And from a quality perspective, what checks are in place to ensure quality and safety in urgent care, and specifically in your urgent care?
So again, that's a very complicated question, but a long question. There are urgent cares that can be certified. So there are certifying urgent care organizations. So the ones that I mentioned already, the National Association for Ambulatory Care, the American Academy of Urgent Care Medicine, and the Urgent Care Association of America will certify freestanding urgent care centers. And what that means is your center has gone through a certification process in which they review your hours, your staffing model, billing services on site, and that you pass very particular certification criteria. Some states are now mandating that happens. It hasn't happened in New Hampshire yet. JACO, which is the Joint Commission for the Accreditation of Hospitals, has an accreditation for urgent cares also. And so JACO can come in and look at your urgent care center and accredit your urgent care center from a quality and safety standpoint also.
Great. How about retail clinics? How does an urgent care center differ from a retail clinic?
So, retail clinics for the most part are, run by larger businesses. Walmart, Target, CVS are the larger ones that do it. They generally are staffed by nurse practitioners. They can also see a wide range of common medical conditions. They usually follow various protocols. And if anything more complicated comes in, they'll send people, to other facilities.
Great. So would they be a referral source for urgent care potentially?
Sure, absolutely.
And how many retail clinics are there in the U.S.?
I've heard different amounts, but probably again around 5,000. CVS is the largest owner of retail clinics, with over 500.
And interestingly, we don't have any. I haven't seen any in New Hampshire. I don't think we do have any. Not that I'm aware of.
Not that I'm aware of, but
in Massachusetts,
they're making a coming in Massachusetts.
Great. And how about again with in urgent care, we see urgent care centers that are owned by hospitals. We see independent urgent care centers. How are those different?
It's interesting, having worked for a hospital-owned urgent care, generally the main thing is the staffing models tend to be a little more generous in the hospital-owned urgent cares because they are often accredited by JACO. You have to have a fair number of staff on site, and they can be relatively busy places. You're also going to get a bill that may have a facility fee on it. So just to give you a quick example, I brought my daughter into a hospital-owned urgent care for a sore throat last year, and the bill was over $400. And so that's very different from a transparency standpoint if you walk into a freestanding urgent care where the bill would be much less.
Yep. Okay, great. And how about if you have a primary care physician? If I'm sick, I'm it might be over the weekend, or maybe I just can't get in quickly. Would that be an appropriate time to use an urgent care center, or how would that affect me as a patient?
Sure, absolutely. And so, one of the things that's very important in the urgent care marketplace is that we don't want to create fragmented care. And so one of the things we do, in our urgent care is we make sure that all primary care physicians are contacted, that they get a faxed copy of the visit and what was done at the visit. They get follow-up phone calls, and so we're happy to talk to anybody. We want to ensure continuity of care. We really want to make sure that people are getting their care coordinated through a primary care medical home model. And even patients who may not have a primary care physician, we'll make sure that they leave the urgent care with a primary care physician visit. It's very important for most people, but it's especially important for people that may have chronic illnesses or an illness that's discovered during the urgent care visit that needs to be followed up on, like high blood pressure, new onset diabetes, gastric reflux disease, or those types of things.
And how have you found the primary care groups here in New Hampshire now that you've moved from Boston versus your experience in Boston?
So the primary care practices in this area are fantastic, and so they have great access. They have great clinicians, and so being in contact with them and contacting them has been very easy for us, and so it's been a really nice relationship.
Fantastic. One of the things that might happen, I would imagine a patient walks in. If they needed to see a specialist, often when I've been in an emergency room, if I've needed something, the emergency room will treat me and then refer me to a specialist. How would that work in the urgent care center?
Another great question. And so usually a fair number of our patients leaving the urgent care will need a subspecialty referral. And so what we try to do is we try to maintain continuity. And so if that patient has seen a subspecialist for a similar problem, we try to keep that relationship intact. If their primary care physician uses a certain subspecialist or likes a certain subspecialist group, we try to use that group. We always ask the patient first, and so patient preference is number one for us. But if they have no particular practices that they may be interested in, we have a complete list of local practices and stuff, so we can offer a variety of subspecialists in a variety of areas. And so I would say geography for the patient tends to be one of the most important factors.
Great. If a patient were to walk in, I guess how often does a patient walk into an urgent care center and is it beyond the scope of what we can provide? And in those cases, how would we deal with that?
So, nationally, meaning patients that would be referred to an emergency department. Nationally, for most urgent care centers, is about 1 to 2% of a total patient volume is referred to tertiary care emergency departments per month, and so that's not a large amount, and so but it is significant. When you get around an urban area and you're talking about urban urgent care centers, that rate might go up to 8 to 10%. So it's a little bit higher in urban areas. And so, hospital-owned urgent cares will often end up sending more of their patients to tertiary care emergency departments. For us, I would say the main things that end up getting referred in are seizures, severe headaches, cardiac chest pain, severe abdominal pain, where we're concerned about kidney stones, obstruction, ileus, and those types of things, or surgical bellies is another term they use, where we would want that patient to have a CAT scan and further surgical evaluation. Neurological findings, signs of stroke, those types of things. We really want to make sure that those patients get over to the emergency department.
Great. So kind of quick rule of thumb, if I'm a patient and I'm looking for, again, I'm thinking primary care, urgent care, emergency room, what are maybe some just quick rules of thumb of things I should be thinking about, what might be the most appropriate place for me?
I mean, always give your primary care physician a call. Your primary care physician knows you better than anyone, and it's always important to let them know what's going on, and they can often make a triage decision for you or help you in your triage decision. So that's always most important. If for some reason they're unable to see you or they feel your condition warrants an urgent care visit, feel free to come over to the urgent care. But again, if any of those things are more serious or you're more worried about something that might fall more into the range of an emergency department visit, definitely don't come
Right.
by the urgent care. And
So if I think my life is in immediate jeopardy,
right.
I want to dial 911
and just get over to the emergency department.
Yep. How about if patients from a cost perspective? So, what's the cost generally of going to an urgent care facility?
So, generally it's somewhere between the primary care visit and the emergency department visit. From a cost standpoint, speaking very generally, most urgent care visits can be, 60 to 80% lower than an emergency department visit, and either equal or a little bit higher than the primary care visit.
Okay, great. And what about patients that may not have insurance? Would those patients be able to be treated in an urgent care center?
Most urgent cares nationally will have some policies in place for self-pay patients, and so usually there'll be a standard fee that self-pay patients can pay up front, and then there'll be additional fees if x-rays or lab work or those types of things are needed.
And what about at ConvenientMD? How do you deal with self-pay patients?
I think there's a standard fee up front that patients would pay, and then if any additional services are needed, there's a list, and so people can check. And it ends up being a very transparent process, and so you can talk to your patients and discuss their care one-on-one.
Great. In terms of a visit, when how long does it normally take to be seen? And first of all, I guess if I needed to go to an urgent care center, what do I need to do? Do I need to call and make an appointment? And then once I'm there, typically, how long does a visit last?
So urgent cares, it's always important to make sure you have your insurance card, make sure you have a photo ID. It's really helpful for us if you have a current medication list and a current list of problems, and definitely the name and contact information for your primary care physician. Those things really help us a lot, and they help us provide a continuity of care and better care for you in terms of follow-up and that type of thing.
Great.
So we love when people come with all that information.
Great. And then how about for appointments? Do I need an appointment? How does it?
So everything in urgent care is on a walk-in basis, so you can walk in any time. Generally, most urgent cares are staffed so that patients can be triaged quickly, can be seen very quickly. With our patient volume, our average wait times are usually less than 45 minutes from the second you walk in the door to when you leave. There's multiple.
Great. So 45 minutes from the time that you walk in the door to the time you walk out the door on average.
Right, on average. And so, of course, there are differences if somebody comes in and they're dehydrated and they need fluids, or they need additional tests, or they have need multiple x-rays or those types of things, it can be a longer visit, but on average 45 minutes or less. And
then again, hours are approximately, I know they vary by urgent care center, but generally are approximately what?
In terms of opening?
Yeah.
Most urgent cares are open usually. We're open 9 in the morning until 9 at night. Most urgent cares are open for more than 12 hours or 12 hours a day.
And that's
7 days a week.
Great. Any other questions, Dr. Collins, that might be helpful, do you think, to share with the community that I might not have remembered to ask?
No, I think in New Hampshire, urgent care is a new form of delivery of healthcare that's really starting to take off in New Hampshire, and so people have a lot of choices, and so it's nice that patients have choices in terms of the healthcare they need and where they can get their services. And so, again, talking to your primary care physician and knowing when and where to go to the emergency department and for what types of things, I think are very important. But for any time the urgent care can be of assistance, we're happy to be there for you.
And I guess one good resource could be our website for patients to check out for additional information about appropriate places to go.
Absolutely.
And for what type of issue.
Our website and then insurance websites also have multiple information on urgent cares also.
And so how about for yourself, what made you choose urgent care? What was, there's a lot of different areas of medicine. How did you end up as one of the national leaders in the urgent care industry?
So, actually interesting. When I left my residency, I did a residency in internal medicine and pediatrics, a 4-year residency at Massachusetts General Hospital. And when I left, I was in the U.S. Public Health Service. And so I had a 3-year commitment as a National Health Service scholar to get involved and did primary care for 3 years as part of the U.S. Public Health Service, and really enjoyed that time. But one of the things I realized is I really liked dealing with acute illnesses and injuries, and less so managing chronic disease. And so for me, treating people when they were sick was something I really enjoyed. I like that immediate gratification of making somebody feel better. And so the urgent care was a great fit for me. I think the other thing for me is I like doing procedures. And so suturing lacerations and draining abscesses and doing all those types of things. And so urgent care provided a really nice mix of clinical skills, but also procedural skills also. So it was a great fit for me.
Great, great. And how have things been going in your transition from Boston to New Hampshire for big hospital to a local community urgent care center?
I mean, I think the thing that I found here is great primary care practices, large primary care practices that really know their patients very well, and so that's been really nice to see. I think the other thing that's very nice that isn't as true down in Boston is the access. So when new patients come in, when patients don't have primary care physicians, getting them plugged into primary care is a much easier process up here than it is down in Boston. I think one of the other things we see is with subspecialist care, getting people timely appointments with subspecialists is something that we're able to do here, and sort of the high quality of subspecialist care is really amazing.
Great, terrific. Thank you so much, Dr. Collins. It's been a pleasure to learn a little bit more about the urgent care industry, and I look forward to our show next week. Actually, excuse me, not next week, but next month.
It's my pleasure, and I look forward to being on the show monthly and bringing other healthcare providers and leaders in New Hampshire in and having discussions with them on healthcare topics that may interest you.